It's been a growing concern now for several years. Cities across the country are working desperately to get it off the streets. But how does the national fentanyl crisis look here in Sioux City? I spoke with Sioux City Police to get the details. It's a crisis spanning all 50 states, a war at the southern border. Not immigration, but fentanyl.
It's coming across our borders illegally.
Like other illicit substances, it's taken its time to move north. Fentanyl has made its way to Sioux City and has resulted in overdoses and deaths. But has it reached a local crisis?
I would say our numbers are increasing since 2020, but nothing close to bigger cities or other areas that have more access to it.
Detective Paul Yanev has been working fentanyl investigations since 2020.
Just like anything else, it starts moving from the coastlines into the internal areas here in the state of Iowa, Nebraska, and that kind of tri-state area.
In 2022, Sioux City Police seized over 20,000 fentanyl pills. Most look like these small blue pills marked with M30. To the average eye, it looks like something prescribed by a doctor. But fentanyl doesn't always look like this.
But it comes in different forms, whether it are colors, and whether it's a bluish green or a white. The M30 is more prevalent around this area, but there's been documented whether it's having the letter K and a 9 behind it, the number 215, or a V as in Victor 48.
Fentanyl typically begins as a powder.
They're taking this powder and pill pressing it, whether it's already pill pressed across the border, or you can get a pill press here in the United States and do it itself, and then they disguise it from there.
Here in Sioux City, it's local residents selling the pills.
The ones that we have arrested recently in either this year or last year or the year before has all been residents or have kind of dual residency, whether in a different state or not, and they come up here and visit. But nothing that we've seen that cartel member or anything like that I've seen, but mostly local people.
And they're selling them to anyone, from teens to older adults.
With this drug, just like any other drug, you're dealing with people that are trying to fit in and try new things and be part of the group. You also have people that are fighting addiction. There's really no target area of age group. It's just, I think, who wants it for their addiction purposes or who's going to try because their friends are doing it.
Let's dig into the numbers. In 2022, Sioux City Police documented 18 confirmed fentanyl overdoses. Now, these were confirmed through toxicology and interviews. It's important to note that overdose does not mean death. According to medlineplus.gov, an overdose is when a person takes more than the normal or recommended amount of something, often a drug, that may result in serious, harmful symptoms, including death. In Sioux City in 2022, of the 18 fentanyl overdoses, 3 were fatal. Detective Yanev says several of those who did overdose on fentanyl thought they were getting something else.
They thought they were getting cocaine. They thought they were getting marijuana. A person might be getting a gram of marijuana or a little thing of cocaine might accidentally have been exposed to a fentanyl, and when they're doing that, reactions are horrible and they get an overdose.
The police department takes fentanyl and any illegal substance interactions seriously. They are working with other area agencies to keep it off the streets.
We try to tackle as much as we can with fentanyl along with other drugs to try to slow it down. It's very hard because it's flooding our borders like crazy and it's coming in and getting dispersed. But anytime we have any fentanyl case, I work with the tri-state area and also other agencies to advise them like, hey, this individual might have had 15 pills and that person told me this and this and this, and of course there's follow-up and there's investigations to do.
Sioux City Police is currently testing out field kits that can test for fentanyl on site. While not currently pushed out to patrol officers, the department hopes to implement these test kits very soon. Now, if you come across any pill or powder that looks suspicious, do not touch it and contact law enforcement immediately. Never take a pill that was not prescribed directly to you, never take a pill from a friend, and never take a pill bought on social media.